The last clinical research method I'm going to discuss is the experimental method. The experimental method is looking at causal factors. So, distinguishable from correlational methods, we can actually ask, does something cause another? This relies on our ability to manipulate variables and measure another variable that is being controlled by the variable we're manipulating. So our independent variable is the variable that we are in control of. That's the one that we're going to put at different levels. That's the one that we're going to manipulate. That's the one that we're deciding upon. We're saying that this independent variable is important. That's the one that we think is critical in the ability to help alleviate clinical symptoms, for example. So that's the one we're going to be controlling in our experimental test to see if our theory is accurate. And our dependent variable is the variable that we observe and measure. So independent variable could be our treatment, and dependent variable could be clinical assessment to see if the symptoms of the disorder have been alleviated. And we can see by giving different levels to our independent variable if the degree of the independent variable, the degree of treatment, so no treatment, low dose of treatment, higher dose of treatment, if those were significant factors in the ability to see an improvement in clinical symptoms. Other factors that make an experimental design a true experiment is to have a random sampling. So getting a random sample from the population. You're not cherry picking cases such as a case study. You're not picking out specific people that are fitting into your theory or fitting into a demographic that you think are going to support your theory. You're getting a random sample from the population that's suffering from anxiety, that could be suffering from anxiety or depression. And the other part is you want to be putting people into random groups. So when you're manipulating your independent variable, a random number are going to get no therapy, a random group of people are going to get the low dose of therapy, and another random group of people are going to get that high level of your treatment or your therapy. So random sample from the population and randomization of putting into groups for your independent variable manipulations. And the other aspect you want to consider is, does the experimenter know which people, which groups are getting which treatment? Ideally, you're going to have a double-blind study where neither the participants in the study know what treatment they're getting, and the experimenter who's doing all of the observations and doing all of the measurements of the dependent variable, the experimenter has no idea which people are in which group. So they are not being influenced in their measurements of the dependent variable by their knowledge of which level of treatment the patients are getting. So a classic question that we're looking to seek out in clinical research is a particular treatment, does treatment X alleviate a disorder? And so experimental design would be our independent variable, could be if we were interested in a new pharmaceutical to treat anxiety, we could look at different doses, different levels of this new pharmaceutical, this new drug, versus a placebo treatment. And again, randomize which subjects are getting what dose of the treatment, and so that we don't know which dose they're getting and they're not sure if they're getting the placebo or the treatment. And then our dependent variable would be a clinical assessment of the symptoms. So you would want to do a clinical assessment prior to initiating your treatment to get a baseline of where the participants were at. Then you assign them to their groups randomly. You do the treatment, say 3 to 6 months. And then at the end, you do your clinical assessment, your dependent variable, and then you see if that dependent variable was significantly impacted by which group they were in of the independent variable. Were they in the placebo group? Were they in the low dose group? Were they in the high dose group of your new pharmaceutical? And then you can say whether or not, let's say that the placebo didn't do anything to alleviate anxiety symptoms, the low dose of your pharmaceutical didn't do anything to alleviate anxiety symptoms, but your high dose, the highest dose of your independent variable, did actually have a significant improvement in clinical symptoms. And you can make sure that it's significant by doing a statistical analysis or analysis of variance in your population to see if you actually did get a significant impact of your independent variable, your drug treatment, upon your dependent variable, your clinical symptoms. So that's the wrap up for clinical research methodology. There are also a few other methods mentioned in your module, so you're going to want to check out your module, check out your textbook, and read up on your resources to really engage in this topic thoroughly and discuss this in your groups in the collaborative learning discussion assignment. And I will be reading that shortly and giving you guys feedback in terms of how well you're answering the question, give you more insight if there's any issues, and please respond to this announcement if you have any questions about those assignments or any questions about these topics that I've presented today.